Hello, I'm here with Kumanan Rasanathan. He's a senior health specialist with UNICEF. Thank you so much for joining me. Can you tell me what a resilient and responsive health system means to you and what action can be taken to make systems more resilient and responsive?
People have been talking about health systems for a long time, and I think resilience and responsive means a lot of different things to different people, and one of the values of this meeting is really to bring together some of those understandings. But for me, I think the most important thing, a resilient and a responsive health system is a health system that meets the needs of people and realizes their right to health. I think what resilience adds to our understanding of health systems is thinking about the unexpected, which happens always, not just with Ebola or earthquakes, but all health systems are confronted with threats that they haven't anticipated. And when we think about resilience, it's thinking about how can we have reserve capacity, how can we adapt our systems, how can we plan so that there is the ability to reconfigure resources. And I think that that's applicable in outbreaks, it's applicable in earthquakes, but it's applicable as we have sort of changing needs of populations, even in a country like Canada. I think in terms of what actions we can take to build resilient health systems, it's really many of the things we've talked about for many years in terms of building a strong health system. You need a good and strong, well-trained, well-supported health workforce. You need enough commodities, you need resources, you need leadership, you need governance, you need health information systems. But I think what resilience adds is thinking, how can we train health workers so that they can be adaptable? How can we support our communities, which is in the end where resilience really lies? How can we support communities to take leadership in times of crisis? And how can we really better support our frontline health workers to have the confidence to take leadership and to make decisions when things change, but also to feed back when things are going wrong that we didn't anticipate?
What actions specifically do you think that Health Systems Global, its members, its partners, including UNICEF, can do to help build these resilient and responsive health systems?
I'd say firstly, help people understand what resilience is and be very precise about it. I think there's a real danger that resilience can just become another sort of catchphrase or tag-all, and we have these in global health, they're like fashions. So I really believe resilient adds something, but let's be precise what it means and what's different about thinking about resilience compared to our existing understandings of health systems. Secondly, let's define key actions that we think work. Now, given that other fields have been thinking about resilience for a very long time, let's learn from those fields. Let's not try and just, as we often do in the health sector, invent things on our own. And then thirdly, let's learn from this building body of knowledge, thinking about resilience in health systems that this conference and this symposium is bringing together, and define some very practical actions in the fields of what do we do with community empowerment, what do we do with health workers, what do we do in terms of commodity supplies, how can our data systems work better, and how can we, I suppose finally, really give people digestible information to decision makers and policy makers so they can understand why they should invest more in resilience in health systems.
What role do you think that health policy and health systems research has in building more resilient and responsive health systems?
I think in the first place, as I've already said, is just building an understanding of the concept and what it adds, what's the added value. If we can't communicate that, why is anyone going to invest in resilience? But I also think that this really takes some new thinking. There's some real governance issues around working across sectors, not just working in the health sector. That's something we've talked about for a long time, since primary healthcare, but we often do it very badly. It's very difficult to talk with people who have different incentives, different language, a different culture, a different discipline. So I think health policy and systems research can assist us in how to do that. I also think that health policy and systems research can perhaps help to define indicators for measuring health systems resilience. I mean, often in the health sector we're flooding people with indicators and what they need to measure, so we need to be parsimonious. But it is true that if you can't measure an attribute of a health system, it's very difficult to monitor whether you're actually achieving it. So I think those two things, helping to understand how to work across sectors and really how to measure resilience in health systems, those are two key contributions that health policy and systems research could contribute.
Well, that's great. Thank you so much for your time.
Thanks.